be an effective disinfectant for so long. Each time before glutaraldehyde and OPA are used, they have to be tested with a test strip. So you take the test strip, and it's not this wide actually. You dip it into the solution, you see, you compare it to the color chart on the side of the bottle. If it's in the right color range, then you can go ahead and use it. So it has to be checked before you use it, because, I mean, think about it. What if you checked it after you used it? Would it have passed the test before you used it? Are those things really disinfected? Was the chemical up to the job? Read all of the words about glutaraldehyde. Orthoplalaldehyde. It's very common to use this. There's a huge difference between orthoplalaldehyde. A couple actually. OPA is not as toxic. It doesn't require all of the same safety precautions. It will require safety precautions, but it does not need its own separately ventilated room. Another huge difference between glutaraldehyde and OPA is that glutaraldehyde, if you look at the chart on page 170 at the top, summary of glutaraldehyde, it says that if you want to sterilize using glutaraldehyde, you can, but you increase the soak time up to 6 or 10 hours. So OPA has no sterilant claim on the label. It can't sterilize. But otherwise, as far as the use of these two things, they're very similar use. Or it would usually be something like a TEE probe, a T probe, or a flexible endoscope. Things that need to be high level disinfected by soaking. Okay, on page 171, summary of hydrogen peroxide. We don't really use hydrogen peroxide in sterile processing, not really as a high-level disinfectant, but it is capable of being a sterilant. So this is how we'll use it. There's a system called the Sterad System that uses hydrogen peroxide vapor, gas plasma, and then there's the V-Pro system that uses vaporized hydrogen peroxide. Both of these, at the concentrations they're used, are sterilants, but we don't generally take something and soak it in hydrogen peroxide. Hydrogen peroxide is pretty corrosive to some materials. And if you're using it out there, I'd be surprised, but let me know what you're using it on and why, and send me a copy of the IFU. Okay, parasitic acid. You might actually be using this quite a bit. You might have an AER in your department that is capable of sterilization. But, okay, I gotta slow down. Parasitic acid is capable of sterilization. And when you put a scope in a parasitic acid machine, it can get the scope inside sterile. But when you open the door on that machine, there's no protective wrapping on the scope, so it is instantly no longer sterile. So it's good enough for high-level disinfection. High-level disinfection may have some inactive bacteria on it, and that's considered okay in most cases. Sterile should not have any bacteria on it. So not having any protective wrapping, because it is a wet process, the parasitic acid process is wet, there's no protective wrapping. So it's going to become sterile, but not remain sterile. Parasitic acid is corrosive to some materials. Pause. Unpause. Okay, page 172. Look, it says read the IFU or follow the IFU to achieve desired results. How many times do you think this book says instructions for use or IFU or some variation thereof? A lot. This is really important. So the blue box says, before using a chemical disinfectant, be sure to review the manufacturer's instructions for use. Using the correct chemical the wrong way is just as dangerous and possibly dumb as using the wrong chemical. Preparation instructions for chemical disinfectants. You should always know the IFU and the appropriate concentration for use, how to dilute it, the correct temperature required, and the water quality and pH requirements. Read the important safety note. Okay, contact time. Wet contact time is extremely important when you're using disinfectants, which, by the way, are all liquid. They're all liquid. So the disinfectant must be wet on the surface of the item being disinfected for a minimum amount of time. Let's just, we'll go back to the alcohol. How are you going to keep something wet with alcohol for 5 minutes? If you're soaking it, it'll stay wet for 5 minutes. But if you just spray it on or wipe it on, it's going to dry up really fast. So in sterilization, we have the steam contact time, right? In disinfection, you have wet contact time. It doesn't matter what the chemical is, it needs to remain wet on the item for the minimum time. So if it dries out before the minimum wet contact time, you have to start a whole process all over again. There's another kind of disinfection. Have you ever heard of pasteurization? So pasteurization is a type of thermal disinfection. Using heat. With pasteurization, you may be familiar with how milk is pasteurized. They heat up the milk to about 150 to 170 degrees and keep it there for about 30 minutes, and that kills the microorganisms that are inside the milk. So we can do something like pasteurization. It's called thermal disinfection, and we can do it right in our washer disinfector machine. So at the end of the cleaning, after the cleaning is all done, the last thing that's going to happen in that washer is it's going to spray 180 degree water on the surfaces of the instruments for a preset time. And that will kill any remaining vegetative bacteria. It is not sterilizing it, it is disinfecting it. And it is not exactly the same as pasteurization. And it uses heated water, to kill bacteria. Okay, on page 174 and 175. On 174, the bullet points list some advantages of using an AER. I think one of the biggest advantages really is that it's not going to take shortcuts. If you look at these bullet points, and you're probably going to get this, the machine is going to do everything the exact same way every time. It's not going to take shortcuts. It's not going to say, I want to get this scope done so I can go to lunch. It's not going to say, I need to get this done so they can have it in the room. It's going to do step-by-step process the same way every time. So that means that it's going to be doing the right wet contact time, that it's going to use lots and lots of rinse water. An AER stands for Automated Endoscope Reprocessor, but it has definite limitations. Endoscopes cannot be cleaned in the AER. They can be disinfected in the AER. They can even have a detergent flush through them, but they can't, there's no AER that can brush the lumen or wipe the external surfaces. So anything that goes into an AER still requires the manual cleaning portion. On page 175, minimum effective concentration testing. So minimum effective concentration is the bottom line usefulness of the chemical. So here's the test strip I was talking about. See, it's quite a bit thinner than this. Okay, so the test strip is put into the solution, you pull it out, and you can compare the color result to the little color dots on the side of the bottle. It's very simple to use. There's a lot of documentation when you're doing high-level disinfection. A lot. So look on page 176. You need to log things like the patient's ID, the doctor, the procedure, what's being processed, who you are, who you are the person that cleaned it, who you are the person that's disinfecting it, what is the disinfecting solution, what date does the solution expire, the result of the test strip, quality test, so you actually have to test the test strip itself, and then the minimum effective concentration test results. Okay, you get it, you can read. In conclusion, I'm leaving it there, and I will see you soon.